Now we're going to go over the principles of an ID or intradermal injection, some of the different types of medications that you would use for this route, and then the process for it. That's a little bit different than the other types of injections we'll go over, and the type of supplies that you'll select. So we'll always start by washing our hands and then obtaining the order and the MAR for our patient. And doing our checks with that, as you guys know. So we're going to be checking our 5 rights 3 times throughout. Move our container from a drawer or a pyxis machine or a fridge in some cases, as it's supplied by pharmacy, and you're going to want to make sure that this information matches up with what you're in fact supposed to be giving to your patient. We're just about ready to prepare our medication, but for any injections, any drug that's being given parenterally, you'll actually want to look up in your parenteral drug monograph, and we'll show you guys those more in the lab, but I have one here to show you. Of course, always, as well as with your drug cards and or drug book, you'd want to know about this medication. As far as preparation and administration goes, you also need to look it up in the parenteral drug monograph. So it sometimes looks like this, and I'll show you kind of what type of information you'll find in here. We've just taken out the Tubersol monograph just to show it better, but what you're gonna want to know, it has lots of good drug information on it. This one's a little bit more detailed than they typically come, but it also tells you how it can be injected. So this one cannot be injected intravenously, intramuscularly, or subcutaneously. It needs to be given intradermally. It is a skin test. So always you want to look up that medication in the parenteral drug monograph prior to preparing it, because if you go ahead and prepare, A, you haven't looked at the recipe, and B, maybe it can't be given via that route that you just spent time setting up. So good to look at first, and then ensure that it can in fact be given via that route, and that you have the correct instructions for preparing it. So we've confirmed now that this Tubersol can be given via the ID route. The next step will be to prepare it. So what we want to do is pick the correct syringe with the correct volume markings on it and size. We also want to pick the correct injection needle, so the correct gauge and length. And I think, as you can imagine, intradermally it's going pretty narrowly into the dermis, so we're actually going to want to pick a very small sliver gauge almost of a needle, and quite a short length. So you do get oftentimes a 1 cc vanish point tuberculin syringe. So lots of units will have this. Because it's marked in mLs and not necessarily unit specific to our Tubersol, this syringe can actually be used for other, say another intradermal type of injection, because it's just an ml. So as long as you know how much of the medication you need, it has a good sized needle on it for that. I will say too, though, that intradermal injections are not actually all that common. The MAN2 skin test is probably the most common one that you'll see, especially on a ward. Perhaps you've had another type of intradermal injection. That would be, say, allergy skin testing. That's an intradermal injection, but that's sort of in more specialty clinic type areas. So just so you know, that is that type of injection. It's not overly common, but it's good and important to understand. So an intradermal injection is just going to go into that dermis and just there. It's not going to go any deeper, so the angle that we insert is going to be a pretty narrow angle, almost parallel to the skin. So we're going to prepare our medication now. We're going to crack the top off of this vial. It's a little bit different than the one you've seen before, but you will see all different types. So this one actually has a metal sort of covering on it, which you can lift up and break off. It's sort of can be easily peeled off. Again, we'll want to clean that really thoroughly, doing a circular motion, applying pressure, and we're going to do that for 30 seconds and let it dry before we get into that vial there with our needle. And just like we mentioned before, because it's a pre-attached needle, we will not be using a blunt fill in this case. But had it not been a pre-attached needle, this is a situation where we would want to use a blunt fill. Not a blunt fill filter, because this isn't an ampule, but a blunt fill. So we're going to prepare our syringe now. We're going to peel it back, open it, again making sure not to touch any parts of it that are intended to be sterile. So really where you want to touch for the most part is just around that barrel of that syringe. We want 0.1 ml, so I just like to look at where that is on my syringe before I go for it. And like I said before, sometimes you just want to move that plunger up and down a little bit just because it can be a little bit sticky at first. So we're going to get to that 0.1 mLs because we are going to inject air into our vial to start. So we're going to put our cap down somewhere. We can easily access it again, and we're going to again try to stab right through the top center hole of that vial. So let's just go for it. And you could probably see these needles are fairly thin, right? So you don't want to be bending all over the place. You can actually bend and break that needle, and in which case you would be starting again. So we're going to inject that air, and now we're going to pull back on our plunger. And we're going to try to get out a little bit of excess because I do see a bubble down there. So we're going to pull out. We're going to recap using our scoop method and push. So I like to use a pen. Some people like to use their finger or the side of the table to sort of tap out those bubbles. It does help if you pull back a little bit so that the bubbles have space, somewhere to go, because there's air at the top then. So holding it upright, we're going to whack right at the bubble. So once you've gotten all the bubbles out, you're going to push this up to get to your accurate dose, which again in our case is 0.1 mLs. And that's our 5 TU. So we're going to do this over the med waste disposal bin, that gray and blue one again. You will note with vanish point syringes, there is a point sometimes where you cannot get the bubble. There is an irremovable bubble at the top of that syringe sometimes. As long as it's above that first measurement marking, that is acceptable. And how you ensure that you get the correct amount is actually by activating the vanish point while it's still in the patient. So we'll sort of review what that means when we go ahead and do it. So just like in lab, as we expect with any med admin, once you've prepared your medication, you're going to want to make a label for it, a medication label, before you move on to either the next medication or really anything else, because now we need to always know what's in this syringe. So we've made a label. We're going to attach this then to our syringe, and just like with the oral syringe, you want to put it somewhere where it's not going to affect your view of the markings. I tend to like to put it right on the cap, especially for you guys because you are reusing your syringes. It's a good way to preserve them too on that side of things. So this is more or less ready to go now. We're going to get an alcohol swab ready to bring with us to our patient. But before we leave, we're going to want to do a second check. So you're doing your second check with your MAR, with your medication label, with your syringe and amount, and with the container you took it from. So it's a couple things that you're needing to actually check and verify. And then you're going to, again, introduce yourself to the patient, talk to the patient, explain the procedure to them, why you're doing this test, that this is a tuberculin skin test. It'll be read in 48 to 72 hours. It's a sort of, it's an injection, so it will pinch a little bit, but it's not a deep injection. And you'll want to make sure that they don't have any allergies, so that you'd want to ask them that then. And that's where you're going to check their wristband, verify their identity by speaking to them and asking them those for those 2 patient identifiers. And then you're going to perform your third and final check at the bedside. So again, reviewing your MAR with your syringe label, what's in your syringe and what's on your label. So we're kind of going to skip that just to get into the injection piece of it. But don't forget those. Don't skip over those when you are giving injections. So We have an alcohol swab. You can wear gloves for this. I'm not going to, just for demo purposes, though it is an injection, so that's a likely risk. So it is a good idea to wear gloves. So we'll clean our hands. We brought an alcohol swab for this one, and we're going to choose a site on the patient that's appropriate. So for intradermal, the most common site, and we're going to clean it. We're going to clean in a circular motion. I just want this to dry while I talk. So we're going to clean in a circular motion, starting in the center and working our way out of the selected site for 15 to 30 seconds. And then you're going to want to let that dry completely. So a good site, or the most typical site for intradermal injection, is actually on the underside of the forearm. And it's a good site because it's sort of a clearer, thinner skin. There's not usually a lot of lesions or hair in this area, so those are things you'd want to look for and avoid. Other places where you will see intradermals done is on the back, sort of near the scapula, but I would say most common, by and large, is that underside of the forearm. So that's what we're going to pretend this site is on our patient. So we're going to uncap our needle once we've verified it's the correct patient and they understand the procedure, and we're going to go for it here. So the one thing that is really important, or one thing that is really important with intradermal, is that you keep that bevel up because of the way, and the bevel is the slit in the needle there, so you want that slit to be up when you inject. If it's down, what can happen is the medication can be dispersed downwards instead of upwards, and we do want to see that bleb in the dermis, so we want to keep that bevel up when we inject. So also with an intradermal, as mentioned, you're almost going parallel to the skin because you're just barely sort of piercing that skin. You're not going deep in at a 90 or 45 degree angle. You're going to go at a 5 to 15 degree angle. So it's very, very narrowly tilted, this needle, with the bevel up. So we're going to go ahead and inject with bevel up at a 5 to 15 degree angle. You're going to go in a couple millimeters there. You could go all the way to the hub, but typically you just go about halfway, and then you're going to inject, and you see the bleb there. In this injection pad, it actually dissipates pretty quickly, but you did see that bleb. It's about a 6 millimeter bleb, and what typically practitioners will do is actually circle that bleb with a indelible ink, so that when the person comes back, if it wasn't a significant reaction, you can actually tell where it was injected. And you saw me there to activate the vanish point. So to activate the vanish point, you depress the plunger all the way in until you hear that click, and it actually snaps the needle back into the barrel of the syringe so that it's safe now. You can't poke yourself with it. This would still go into the sharps container afterward, but you do want to activate that vanish point so that they get the entire dose. And with any injection, you don't ever want to massage the site, but especially with intradermal, because you don't want that medication dispersed within the tissues. You actually do just want it to sit there, because that's where you're going to want to see if there is a reaction. That's how and where you're going to see it. You don't want to disperse it into any deeper tissues. So with an intradermal injection as well, we're going to document on it in our MAR, but also we would want to document in an IPN about the site that we chose, which arm, where on the arm did we circle it, when the patient is expected to come back, or the test is expected to be or needing to be read, if it's an outpatient situation, that kind of thing. So that's pretty much the basics of an intradermal injection.